It started, with just some decline with memory and noticing that they weren't doing as much as they used to do, not eating as well. And then when it became evident that they were going to, that they were moving into the last few months, probably last 6 months of their life, we asked for a referral to hospice. I knew I was going to stick with VNA because the skilled nursing service had gone very well, and it was an organization that had a great reputation in the community for a very long time.
I have goals of care conversations that start out by finding out what the patients and families' goals are, and then integrate my knowledge of the disease processes and the trajectory of these illnesses so that we can come to a common understanding about what the goals of care are and to honor their goals with dignity and empathy and to communicate that to the team.
Towards the end of the life of my private care patients, when I started educating them towards the end of life, it was a very difficult conversation for them. And that's what kept me very interested in continuing hospice care. Helping them, the family members with the emotional stress they go through, knowing that their family members are going to pass away. Well, as medical director of the VNA Hospice, I'm involved in care coordination, care planning, ethics, decision making, but it's always a team approach. We're truly available for them 24/7. There's always a nurse on 24/7. I'm on 24/7. Actually, hospice and palliative care overlap. Palliative care is taking care of the patient's chronic illnesses, whether they may be chronic lung disease, heart disease, whether it be end-stage cancers. But these are patients who are seeking continued long-term care. They want to seek all the treatments available to extend their lives. Eventually they reach a point where their primary care physicians or their specialists will say, we have offered everything available to you, and it's time that you should consider hospice. And that's when we come in. We're not involved in extending anybody's life. We're really focused mainly on end-of-life care, quality of life.
So our home care hospice team would comprise of a primary nurse, a social worker, a chaplain, a music therapist. We have volunteers that can go and be companions in patients' homes, as well as our bereavement team, who offers bereavement for patients and families for 13 months after someone passes away. At the VNA Hospice, we can offer our hospice services wherever the patient might live, whether it's a skilled nursing center, an assisted living, or their home.
As medical social worker on the hospice care team, we have a variety of different roles that we play, from providing therapeutic support and resources, financial resources in the community, care planning, working with the families through anticipatory grief. We're really there for the patient and the family and any caregivers who are involved in the patient's life to make sure that the patient's environment is kept as comfortable and calm as possible during that time. And I think one of the things that I've been most enlightened to is that death and the journey towards death doesn't have to be filled with grief and sorrow, that it can be really meaningful.
So the grief work is incredibly meaningful. To be able to companion someone and be present for them in sometimes what's the most painful time in their life, having lost a loved one. I think grief comes in waves, like the ocean, and sometimes it can be a really small wave, and other times it can hit you hard and feel like a tidal wave. And so to be able to be with them, to help them keep swimming, it's a gift. When we're leaving this earth, we need to be held. And people can sing to us, and people can feed us, and people can take care of us, and we can leave in the same way we came in. And so to be able to give that to people, and then for me now, to provide the support through the sadness of that loss of that person, it continues the gift.
We offer in-home hospice services as well as a different level of care called general inpatient at our McCarthy Care Center. The McCarthy Care Center is located in East Sandwich. We have beautiful grounds here, including a gazebo and a wooded area in the back.
I've learned that when patients and families come to us, Some patients don't have families, they're isolated, they're scared. The families are really exhausted from what they've gone through. I kind of take their burden off their shoulders, kind of relieve them from their duty of caring for their loved one. And I do all the patient care and support with the family so that they can rest and enjoy, get some sleep, and enjoy the last little bit of time that they have left with their loved ones.
Our daughter was a patient with the VNA hospice. They gave us all the equipment we needed, the special bed, the special oxygen, the chair to help us get her in and out of bed, the tray, everything that we could possibly need, and was all done ahead so that she didn't have to experience the commotion. And when we got to a point where we weren't comfortable, that's when we talked about the next step, which was to go to the McCarthy Care Center. They were all there waiting for her. They had her beautiful room ready. It was just like she was treated like a queen. And as soon as they got her settled and medicated, it was like a sigh of relief that I wasn't responsible anymore for her pain. That was a blessing. Those were a true testament of having these angels on earth.
I think oftentimes people think of hospice care as a person who is dying. But hospice care, and if you ask any person who works in hospice care, they would say what I always say, which is people will die, but every day before that day, they're alive. So we care for the living who are experiencing the impact of serious illness.